So, Doug, welcome. We are episode 18 of the Bulletproof Backs podcast. Would you like to introduce yourself to the listeners?
Thanks, Marion, for inviting me along. Yeah, sure. So, Doug Carey, I'm a physiotherapist. I work in a rural country coastal location called Esperance, probably the best place in the world. So, if you haven't been there, it's where
Outside of Margaret River.
Yeah, well, we're going to have our own little parochial bents. Been a physio for about 30 years. So I started out in WA, moved overseas for a couple of years to Canada, and came back to Australia to do postgraduate studies. And that's when I started to realise that the world of physio had moved on. We basically had started to learn about the biopsychosocial model. So the management of things like chronic back pain or subacute back pain started to have a different bit of a glean to it rather than just a hands-on approach. We started to realize that there were many more factors that contributed to a person's pain experience. And prior to that, and this might seem a bit weird to younger physios, but really it was just like a hands-on manual therapy type approach. And that really was a bit of an eye-opener for me because I came from Canada where they have a very eclectic approach to treatment of backs because they don't really have a kind of a guru. Like in Australia, we have gurus that have sort of directed us in how we treat things. There they didn't. So they had the best of everything. They had really good assessments from Australia, from Maitland. They had a lot of treatment stuff coming out of Europe. And they had also a lot of treatment stuff coming out of America. So it was kind of an opener for me coming from WA, which is very much manual therapy based, and seeing a broader perspective. And then coming back to WA several years later and seeing how things had moved on in some ways. But that was the start of the biopsychosocial model, which was important for a treatment management plan. I then moved country, rural, and became more interested in managing patients that presented to me with no symptoms, say, the evening before, and then they woke up in the morning with quite severe neck pain or back pain. And that did make a lot of sense to me because essentially nighttime is rest and recovery. So why were they waking up worse? And that sort of led me into asking some clinical questions and a little bit of research. And I realized, interestingly enough, that no one else had gone this direction. There was a lot of anecdotal information in textbooks, but there was actually no research that actually could guide a clinical decision as to say to a person, well, this is probably what's going on and this is how we're going to approach it. So to my simplified mind, because I'm a farmer, so I'm also very pragmatic, it was either going to be to do with their bed, like there's what we call their sleep system technically, which is their pillow, their mattress in the base, or the position they slept in. So that was a sleep posture, like a mechanical loading. And that essentially led me down to a PhD, which was a long 9 years because I did it part-time and I had to go through a process of doing a master's and then into a PhD. So that sort of wrapped up a couple of years ago. And then I was also around that time also doing what's my clinical specialization in musculoskeletal physiotherapy, which is essentially a 2 or 3 year program where you're trying to really push yourself clinically. And that was very good for me because living remote, I didn't have a lot of people to bounce ideas off. I'm very lucky to have a very beautiful, intelligent wife that sort of we bounce ideas off, and she's a physio as well. So that's a godsend for me and her to have that capacity. But I wanted to keep in touch with what was happening in the bigger world as far as physiotherapy and the management of patients. So yeah, in a nutshell, I'm a country physio. I like the diversity of experiences. I like to be challenged. I like playing the clinical detective and trying to work out and get into a person's life what's contributing to their symptoms, and then coming together with some sort of plan of resolution and helping them work through that process.
Yeah, that's great. And Doug, the reason I've brought you on is because there's physios and there's physios as I see it, and there's those that are eternally curious about why, and they don't necessarily accept the answer that they're given. They sometimes go down rabbit holes and in different directions. And, I can tell by your email updates that the way you think about problems is quite lateral and practical. I think there's a lot of skill in that. And, I love seeing physios that are passionate about expanding and exploring our baseline model of understanding of the body in whichever direction that takes us. And, so first of all, just You inspire me. It's great. I love reading, seeing, hearing about physios like you that are passionate still 30 years into the game about our profession. So hats off to you. And now let's share some stuff that our clients who are, you know the client who we're talking about necessarily what you're talking about, the person who wakes up, and they're crippled and they can't get out of bed. I guess my target market for people are those that have, heading now into 6 months of stubborn, persistent back pain. They've tried everything. They're just stuck in this cycle, and sleep, no doubt by this stage of their clinical experience, will be interrupted. It will be affecting their pain sensitivity. What do you feel is worth, from your research studies, helping these people know about in terms of sleep and how it impacts on either their pain or their healing experience?
Yeah, well, I think if we take the word back pain, I think there's two parts. That one, and this is what I've kind of come to understand as well. One is that when we talk about pain in general, people, and I wasn't aware of it myself, if you're short sleeping, which is basically 6 hours or less a night, it essentially means that your body's not going through its natural processes of recovery. So the first half of the night really is when we go into stage 3 and stage 4, which is our deep sleep. And that's when a lot of our restorative things occur, both in our body and our brain, and our tissues are healing and our growth hormones being released, and where our body is improving. So if you've trained, you're going to recover. That's when you do recovery. The second half of the night is more to the dreaming. So it's like knowledge assimilation, and where our brain puts together information that's learned that day with previous information, so we can fly and we can jump tall buildings and we can swim undersea for minutes. And basically our body is in recovery, but our brain is doing all the linkage with our past knowledge with our current knowledge. And that's why the second half of the night is important. When it comes to pain, if we're short sleeping, our body is not getting that deep sleep. And that means that it's actually susceptible to experiencing pain, even though you've not had an injury. So we now know that if people are short sleepers, that's a precursor to or an antecedent factor for them experiencing musculoskeletal back pain. And that doesn't matter whether an adolescent or a kid or a young adult or an adult. The research is quite definitive in saying that if you're short sleeping, you are setting yourself up for musculoskeletal pain. And that's not with an injury, it's just getting pain. So then if we broaden that out to back pain, then we start to realize that if you're short sleeping, you're setting yourself up for pain. But if you got back pain, we used to classify back pain as acute, like it's a few weeks, subacute, less than 3 months, or chronic, more than 3 months. The thing about low back pain is that the number one factor for having low back pain is that you've already had it. So essentially, low back pain is now thought of as being a series of flares or trigger events with small gaps of no pain in between, or just minor pain or less pain. And basically the number one factor they're now looking at, or one of the key risk factors for these flare events, is poor quality sleep. So, and the flip side of that also is if you have good quality sleep, it's a protective factor. So sleep is becoming more and more important as we become more aware of its involvement with pain as a general topic, and then also specifically with low back pain and these flare events. And then my kind of area of research particularly was looking at the relationship between sleep posture and waking spinal pain and sleep quality. So the sleep quality is a whole new ballgame. So I'll get to that in a moment. But sleep posture relates to the position that you sleep in at night and how long you stay there for, and whether that's going to be supportive or provocative of the stress of the tissues of your low back. And that's where we sort of had to create new methods of imaging people at nighttime in their bedrooms, because we want to make it as realistic as possible and not rely upon sleep centers. So we had to go to bedrooms and put cameras in and watch people and their animals and their pets and sleep routine. Wow. And it was pretty interesting what some people do in their bedrooms at night. But we'll leave it at that.
Oh, come on. Give us one. Give us the most bizarre, awareness of what's going on for someone sleeping at night.
Okay, so a tame one would be that a lady, because we would record over 2 nights. So in case there's a power failure or something happened to the equipment, we'd have a night of data that we could utilize anyway. Otherwise, we average the data over the 2 nights. So this lady said, look, I'm not really sure if you want to use the data from the first night, because the kids kept on coming in all night and they were kissing me and they were disturbing me. I had a really restless night. You might want to just scrap the first night's data. So I said, that's fine, I'll have a look at it. So I was, and that's why I sit there with a remote control. I'm watching, people go to sleep and go to bed. And it wasn't the kids coming in every hour or two and kissing. It was a big Dalmatian dog was coming in and licking your face.
Oh my goodness. And
so,
animals sleeping on the bed is a big deal for body position limitations, isn't it? As well as toddlers and kids. Yeah.
Kids in bed, babies in bed, dogs in bed, cats in bed. So yeah, they're all eye openers for me when you start talking about fleas and lice and just all sorts of other stuff. But we won't go there. So sleep posture is important, and we had to develop criteria for what sleep postures were, because again, it was new area of research and it hadn't been done. And we essentially found that whilst most people are familiar with lying prone is probably not an idea. So when your face is down into the bed or your chest is on the bed, that's not an ideal position for either your neck or your back as far as providing with what we call a neutral position. So that's pretty obvious. In lying your back, the opposite of that is obviously fairly safe as far as your back is considered. But it's this side lying position where about 70% of the time is spent. So most people spend most of their night in side lying, but that can range from, say, the recovery position, like in CPR, where you're in a position for unconscious vomiting people, or it could be, say, lying on your side where your hips and knees are bent like a fetal position. So we had to make some decisions about what we'd consider provocative side lying positions and supportive side lying positions. And at the end of the day, when we looked at our stats, that's what it came down to. When we went through and educated people about supportive side lying positions and supportive sleep positions full stop, it was that side lying component that changed from being provocative to supportive that made the biggest difference. So that was one take-home message that we found. The other one was that you can educate people. So most people said, well, if I'm asleep, how am I going to know what I'm doing and how can I make adjustments to that? And that's a fair call, because essentially we didn't know either. But it would seem to be that if you explain to a person, and this is what our most recent paper is that we're sort of putting out, getting together now, is that when you explain to a person through a sleep posture intervention, the majority of people are able to make that change. And as a consequence of making that sleep posture change their routine, they experience less waking symptoms. So it's a win-win for us as physios and health professionals, because we know that there is a relationship between sleep posture and waking spinal symptoms. And we know there's a relationship between educating people and their ability to change that sleep routine. So yes, habits are routines that we have, but they are changeable.
And there's seems to be a fair motivation to change simple habits. If you're waking up every morning in pain, the concept that you can simply make a few adjustments to your sleep posture and get out of bed, but potentially feeling a lot better, seems to me like one of the easiest methods to explore. It's not going to cost you anything. There's no real mental power or physical effort involved. And your body will, in a few short nights, probably validate for you that yes, that's making an impact, or no, it's not. So yeah, simple stuff. Hey, really, I'm always amazed at sometimes how much we can make things complex, but I think that's a really good simple strategy that back pain sufferers can start to explore.
Yeah, it is. And as you say, it costs nothing, although the mental fatigue of trying to change a habit can be challenging. But sort of go one step further with my clients and sort of say, look, you've changed your position and you're getting the benefits of it. Now I'm going to crystal ball you in 3 or 4 months' time, and I'm going to guarantee that you're going to wake up with back pain again. And they look at me like, what? That's not a very nice crystal ball sort of picture. But I say it's because a habit is a habit. It's deep. And the thing that you'll learn from that is, even though you've made conscious efforts to change your sleep position, at some point in the future, whether it be from a few nights of busyness and work and you crash, or you have a few beers or something else happens and you sleep somewhere in a different position or a different place, you're going to wake up sore. And that's just an affirmation. It's not a bad thing. It's an affirmation that you made a change. It's been good, but you've got to stay with it.
Yeah. And in which case, the pain again is serving the person, isn't it? Like it's the feedback that they need, the alarm system saying, "Whoa, you've slipped back into something we really didn't enjoy. Just letting you know, might be a good time to mix up that sleep posture again." And I think a lot of what, for my model of how the body works, when someone lays down, and they will, as you would appreciate, clients say, "Well, how should I sleep?" And I hate the question where someone wants me to specify exactly for them what they need. And sometimes I give very loose, open-ended answers that, well, how do you feel most comfortable? That's the position you should sleep in. But in sleep, that position over a long period of time may then become a counter strain sort of phenomenon that the body is then sending tissue feedback, but because the brain's asleep, it can't respond in real time to that. So, it is one of those circumstances where I think the rules bend, and it's easy enough to start playing with them in a different direction.
Yeah, I think the difference that, and this is what I had to sort of grapple with as far as my research was going, is that we have, and we won't get too technical, but physiological creep is the phenomenon that under constant load, our tissues elongate. And when we're awake, we have a nice system called the muscle system, which provides us with a brake or a protection or a sort of a support structure. Obviously, when we're asleep, we don't have that system. And then the other system we have when we're awake is gravity. So gravity in regards to the spine provides a compressive force, as does muscle contraction. And that means that when we're moving around, those two forces bring our joints closer together, and they provide both a muscular support and also a joint or an articular support. So our range of motion is limited. Now, when we lie down, we lose those two compressive forces. And as a result of that, our tissues don't have that background protection, and we can go a lot further. We have a greater range available. So what we call our neutral zone is much greater. And that also means that whilst the neutral zone is greater, the soft tissue, the passive restraints, our ligaments, our joint capsules, our discs, the fascia, those sorts of things that can't protect themselves are now put under constant load. And it only takes about 15 or 20 minutes of sustained load to cause physiological creep to occur. And once that gets about 3% elongation, we start to get pain signals, but we're asleep, so we don't pick up on those on an early motion. So lying down at nighttime and being unconscious or asleep, we have to be a lot more specific about the positions that we put our body parts into, so we don't bring about that increased load on our passive restraints, because we don't have the two natural supports of gravity and muscle contraction to protect our pain-sensitive structures.
Yeah, they're key points. Really good points to make there. So is it a case of getting back to that patient who says, well, that's great, I may drift, I know what to do drifting off to sleep, but how am I gonna make sure I stay, in a safe position through the night? Is it a case of creating an environment with pillows and props that encourages the body to stay in these positions?
Naturally, most people will change their position if they consider what's a good sleep about 15 to 20 times a night. And what are considered poor sleep is a double that, so around 20 to 40 times, or 15 to 20, 30 to 40 times. So that's the classification based upon how restless almost you are at nighttime. The thing about sleep is it's not a deep dive into sleep and you stay at deep sleep. We go through cycles of sleep. And when we come out into a deep sleep and we come up into shallow sleep, there's a period of what's called brief awakening. And it's probably sort of a evolutionary trait to sort of check for saber-toothed tigers and smell for smoke and danger, things like that. So our body is naturally going to come into a shallow cycle and check for danger. And it seems to be that if you insert that little piece of information to the brain saying, look, sleep posture is important, this is what you've been doing, this is what you need to do, and that'll help your back pain. When they come into that shallow period of sleep, not only do they sniff for smoke and check for saber-toothed tigers, the brain's actually also going to say, where's your leg? What sleep position are you in? Okay. And then if it's in the wrong position, they go, all right, correct that. And then they go back into the next sleep cycle. Yeah, so essentially 15 or 20 times a night, you're going to have some sort of conscious awareness and you can change your sleep position. Now, the thing about memory at nighttime is that if you don't stay awake for more than about, I think it's 30 seconds to a minute, you actually don't remember what you did. Like, we have to be awake for more than a couple of minutes to actually lay down a memory of what we were doing at that period of time at night. So you might not remember doing that, but it would seem to be that people do that by giving them that piece of information about correct sleep position.
Yeah, right. So it seems there's a multiple of factors. You know, you can stop the provocation of the physical tissues with a great posture or an improved posture. You can also then, via, you know, encouraging the brain to go into those deeper states, you're healing the body's ability to heal whatever irritation you have triggered is greater. And then from a sensory perspective, your thresholds for stimulation are naturally greater if you are feeling more refreshed, more energized, less fatigued, yada, yada, yada. Are there other factors that I haven't thought about there?
Oh no, I think back pain is definitely multifactorial. So you've got to tackle it from many different directions to get an optimal outcome, and sleep is just one of those.
Totally.
But sleep,
But it's not spoken about much. And
no,
I think there's this idea that if you buy a good pillow or you buy a good mattress, you've done, you know, you've taken care of that. So you could have a really great mattress, but still be in a really awful posture on that mattress and not get the full benefits of it.
yeah, and that's a key thing to listen to in your subjective history. If a patient's saying, "Look, I've got Imelda Marcos cupboard full of pillows," then that's really telling you that yes, they are not addressing the issue. And essentially, I'll say to patients, "Don't buy a pillow from us first. Let's change your sleep position. Let's work on that for 2 or 3 weeks because that's a much cheaper option." And
Yeah.
invariably, it's going to be a better option for that particular person. Now, if they still have an issue once they've corrected their sleep posture, okay, let's talk about
Yeah.
mattress and base and pillow.
Yeah. And how does that conversation go? Do you have preferences or suggestions on, um, because again, it wouldn't be the best. There's no one mattress that's going to fit every spine and no one pillow that's going to work for everybody. That conversation.
No, there's not. So the conversation starts around the sleep position. And look, if people are interested in that, I've got a bit of a fun thing. It's called a 14-night sleep posture challenge. And there's a section in that. So they basically just sign up for that. And we'll go through exactly like a video, word for word, how I educate people on changing their sleep posture. And there's also a little section in there that talks about the sleep mattress, sleep pillow system based upon research and how I sort of guide that conversation. And they can also, there's a little sleep hygiene handout that sort of goes through the typical things for primary insomnia that people can sort of consider if they're trying to improve their sleep profile as well.
Yeah, magic. All right, Doug, that's a wealth of information and you articulate it so well. Can we consolidate it into 3 top tips for people experiencing stubborn, persistent back pain? What would yours be?
Well, I mean, we've got to remember that we have to address pain, low back pain, as in a biopsychosocial model. So that means that we've got to look at the different elements for that particular person that might be contributing to the symptoms. So as a general thing, I would always make sure their sleep posture is appropriate so that people listening to this can go into that sleep posture challenge, put themselves through it, check out their own sleep posture, get the background information in regards to mattresses and pillows, tick off the boxes for their sleep hygiene. And that's a big part, because if you are sleeping well, good quality of sleep, that's going to go a long way towards not only helping your back pain, but your blood pressure, your fertility, your ability to maintain a healthy body weight, to learn, to memorize. It just, every single system in the human body is on a downward spiral if you're not getting an adult 7 or 8 hours of quality and quantity sleep. So sleep is definitely one of the biggest ones. Then if we talk about biopsychosocial, we've got to touch on anxiety and depression. So stress. I think that's, we live busy lives, full lives, if that's how people want to look at it. And if that's not balanced out with an appropriate amount of downtime, mentally and physically, then they're going to be experiencing poor sleep. So that reflects back on the sleep as well. But it also depletes their adrenal systems and it has other effects on their body. So having a good balance in the work lifestyle, I think is a critical thing. And that's where we can sit down with people and sort of say, well, look, how are you coping? How are you managing? And sleep is an indicator. It's like a flag. So if they're getting poor quality sleep, or they can't get to sleep within 30 minutes, or they're waking up during the night and find it troubling to get back to sleep, they're suffering from insomnia, which is poor quality sleep, and that is going to influence their back pain as well. So That's the second topic, would be just to sort of tick off from that base on the biopsychosocial. So the bio would be the sleep posture, the psychosocial would be the anxiety and depression, and mental health and well-being. And then I think we can't really go beyond strength and conditioning. So the third thing would be to sort of find out what sort of fitness program is this person doing, what are their perceptions about the importance of fitness in their lifestyle, and making sure that it's appropriate. Like, you can do too much and you can often do not enough. So it's a matter of sitting down and saying, well, for flexibility, for strength, for power, for endurance, what are you doing and how is your body responding to that? And making sure that box is being well and truly addressed as well.
Yeah, I just want to add in there, or you could do all of it well with poor quality.
Yeah. So you often, so you need to sit down with people and sort of say, look, explain to me what you're doing, and let's see if we can sharpen that up a little bit.
Yeah. And I think there's a misperception about what quality movement looks like, feels like, is. It's often nothing to do with how strong you are or how flexible you are. Certainly those factors contribute to it, but they don't have, you can have quality movement without either of those other two factors, I think, which is a really big deal. So yeah, I love that. So sleep, bio, that word, the biopsychosocial, I just tend to say holistic because it's simpler for me, it's simpler for my patients, but I like it. And I think anyone acknowledging that, to heal our bodies, we need to be conscious of our thinking and our emotions and how we move and how we sleep. We have to look beyond the pain part and look at everything that's influencing the pain part. And, sometimes it's not actually doing more, it's about doing less. So in terms of sleep posture, it may be you don't necessarily have to, you simply have to pull back from what you're doing and do something, and same with movement, same with conditioning. Do less of the things that provoke you and you're still winning in terms of healing. You don't necessarily have to add anything to the table. But yeah, I think this is a nugget, actually, the sleep aspect. It's certainly something I've known is important, but I kind of haven't fully until this chat really embraced the level of importance in it. So I think if we can have that seed sown amongst the listeners as well and the practitioners, that's a really good, worthwhile conversation to have. So good work on your research. I'm grateful.
You're very welcome. It was fun.
Final question, bulletproof back. What does that mean to you? What does that look like to you? What does that feel like to you? Do you have one?
Yeah, well, I do actually, but I think it comes back to those three other points, like a bulletproof back. I mean, the reality is, and we go back to that concept of flares, is that 80% of people are going to experience at least a couple of weeks of back pain. That's one 80%er. And the other 80% of people is that they go through fluctuations of back pain. So we need to look at things like what we call risk in the research, what we call risk factors of back pain. So what's going to trigger it? So to me, I sort of divide it into two ways. One is like, we've got to build up greater resilience in a person. So that's like those things we talk about: strength, conditioning, fluidity of movement, anything which is going to build that person's capacity. So that's one thing they can work on. And that might be psychosocial. So they might learn breathing exercises to learn to relax, get better, control of their heart rate during the day, so they don't sort of feel like they're addressing themselves over the top with what they're trying to do. So that's building resilience. And then the other side of it is looking at what we know from the research as far as what are risk factors. And so that can be things like anxiety, can be depression. But what's really coming out, interesting enough, and it's just last year, they did a big paper on risk factors, and the number one, lo and behold, was sleep quality. So they found both on the side that poor sleep quality was going to be one of the number one risk factors for a flare of back pain. And although it doesn't always happen, but they also found that good quality sleep was preventative or protective of an episode or flare up of back pain in the next 2 or 3 days. So it doesn't always work both ways. Sometimes poor quality, something or other can cause it, but then having a lot of it doesn't mean you're going to be protected. But in the case of sleep quality, it was both an antecedent factor for causing someone to have a flare up of back pain the next day or two. But also if they had good quality sleep, it was protective of it. So, if someone has ups and downs of back pain, just on that sort of research basis, you would want to be working on your resilience, yes, but you'd also want to be very much aware of and achieving optimal sleep quality. So to me, a bulletproof back is somebody that's across both spectrums. They're looking at the preventative stuff, resilience, and they're looking at their sleep quality and how to improve that at every single turn, like whether that means coffee, stopping at lunchtime, or no alcohol after 4 o'clock, or no screens, or regular amount of exercise, or box breathing. They've got to work out what it is that's interrupting their sleep profile and make some serious gains on that.
Yeah, and those gains will flow on into numerous other areas of their health, in terms of energy and focused clarity thinking. It will help them access better thoughts anyway, and better emotions. And it's a win-win-win. And quality sleep you can't buy. There's no pill for it. Or is there? Is there one that I remember in my lack of sleep days with my youngest child, 4 times a night, just thinking, is there a pill I can take?
See, and that's, think about fresh water. Well, fresh water, you can't even say actually you can buy fresh water, but just look at sleep now. Just because it's free doesn't mean we should take it for granted. We used to say that about fresh water, but now you actually have to buy fresh water. Yeah. But sleep is another one of those things that we have it for free. Like, it's there, but we do tend to take it for granted. And unfortunately, the cost to not getting good quality sleep is in lost life, essentially.
Yeah.
Just as a diversion, we sort of talk about the benefits of sleep. I mean, here we are still post-COVID, or in the middle of COVID, however you want to view it. But one of the things about poor sleep, like short hours of sleep, is that your immune system is suppressed. So there's some papers looking at if you have short sleeping for 2 or 3 nights and then you go off and get your 3rd or 4th COVID injection, it actually doesn't trigger your immune system, simply because it's too fatigued. So there's no point having a flu injection, or there's no point having a COVID injection or any of these vaccinations if you're not getting good sleep, because your body doesn't have the capacity to respond to that stimulant to build the antibodies. So it's just another small example that short sleeping is going to affect us in many, many ways.
Yeah, it does kind of remind me of the book Our Breath, the lost art of breathing. It's a fundamental practice that we're doing in every moment. How we breathe matters so much for every system in our body. And if we strip health back to some basics, if you're breathing well and you're sleeping well, you've probably got 80%, and I would say moving well and probably feeding yourself some decent food, you're probably going to be pretty covered on most aspects of health. So the simple, cheap, portable, easily accessible stuff works, but because sometimes it's not valued, we don't put emphasis on it. So hopefully this episode has.
Yeah, so that'd be great.
Awesome. Thanks for sharing your knowledge. And we will put those resources in the show notes with all your links. So if any of the listeners are keen to go and learn more, which I really hope they do, especially your advice about, how you go through it with clients, I think that would be really great for people to access. And again, thanks so much for your time today.
Thanks, Marion, for giving me the opportunity to share some information with your listeners.
Too easy.